Hey everyone, so thank you so much for tuning in. My name is Chloe and this is my capstone project about the use and effects of meth. So first we want to know, what is meth? Meth is commonly referred to as speed, crack, ice, crystal, and tina. It is made using a variety of different household products including ether, paint thinner, drain cleaner, lithium for batteries, lime, ephedrine, and is produced in the form of powder, pills, and crystals. How meth is used. The drug can be inhaled, snorted, smoked, taken orally, or injected intravenously. Actually injecting the drug intravenously is one of the most popular forms of administration because the euphoria felt is immediate. So the euphoria and the high from methamphetamine is very potent and it is very long. The high from methamphetamine can last 10 to 12 hours, and users feel energetic, aroused, and alert. Um, Upon injection, users often report like a rush um, after using the drug, and the intensity of pleasure following injection, however, is very brief, and users struggle to reach the same rush as pleasure levels at first. So very much chasing their first high, and which leads them to continue using it, and it leads to addictive behavior. So I've always kind of referred to meth as kind of the mother lode of dopamine because it releases over 1,000 units of dopamine, and the brain isn't meant to produce such high levels of dopamine, and it's impossible to produce such that high amount naturally. And with repeated use, addicts are depleting their levels of dopamine that make it difficult to experience pleasure naturally, as users report feelings of depression after the euphoria. This damage, however, can be repaired with sobriety, but users still often show impairment in other cognitive abilities like memory and judgment. So with short-term use, I noticed that there tends to be more physical effects and tolls on the individual, where long-term use crosses over to physical as well as psychological. Acute and short-term meth use has immediate effects on the individual's physical health, such as alertness, heart rate, blood pressure, body temperature, and a loss of appetite. With long-term use, the drug has severe consequences on the user's physical and mental health, such as tooth decay, infection, malnutrition, paranoia, depression, psychosis, and violent behavior. Even when the drug use stops, the symptoms may continue. So meth psychosis. The longer an individual uses meth, the greater chance of psychosis. Meth-induced psychosis often resembles schizophrenia. It includes hallucinations and delusions. Auditory hallucinations are the most common in meth psychosis, followed by the delusion of persecution and reference. So some of the common physical effects seen in meth is the scabbing and the scarring on the face and body. This is from the users engaging in skin picking and feeling like they have insects crawling at their skin, as well as meth mouth. This can be seen, Meth mouth can be seen even among short-term users, and it is the decay of the user's teeth, more common in those who snort or smoke methamphetamine, and this is often treated by extraction of the user's teeth. During withdrawal from methamphetamine, users experience anxiety, depression, lack of energy, and an inability to feel pleasure. These symptoms are due to the decreasing levels of dopamine when the user stops taking the drug. Some of the effects on society. Meth does cause users to feel aroused and confident, which does cause them to engage in risky sexual behavior with multiple partners, which does contribute to the spread of HIV. Meth users may also commit crimes leading to incarceration, which does also play a role in families, separation of families, and children in foster care. Meth use is associated with death rates and homicides, traffic accidents, and suicidal thoughts and behaviors. Some of the highlights: meth is addictive by releasing high levels of dopamine. Common physical effects include meth mouth and skin infections. Prolonged meth use can cause brain damage. Depression is the most common symptom felt during withdrawal. So an important take-home message. I feel it's important to understand that with any addiction, there's often biological, social, and psychological implications for the behavior, and I feel like this is an important point to make in how we view meth addiction, how we treat it, and how we should make an effort to try and stop people from using meth, as well as helping those who are addicted, because it does affect society on a whole. It doesn't just affect the individual. And I chose this topic because meth use is still a growing problem that needs to be addressed, and I have personally known people who have used meth, and I just wanted to gain a better understanding on how meth affects the body, both physically and mentally, and maybe why it's so hard for people to stop meth use. And here are my sources. Thank you guys so much for watching and for listening. I highly recommend these sources, and I look forward to seeing your project as well. Thank you.